COPD stands for Chronic Obstructive Pulmonary Disease. It's actually a group of diseases, including emphysema, chronic bronchitis, and non-completely reversible chronic airway disease. It means the airways from the largest to the smallest in the lungs are inflamed or swollen and partially blocked. COPD is a long-term disease that gets worse over time. We could make a parallel and say that COPD is rather like Alzheimer's disease, but affecting the lungs. COPD is characterized by persistent respiratory symptoms that include breathlessness, coughing up mucus or phlegm, fatigue, and frequent respiratory flare-ups or worsenings called exacerbation. We take more than 500 million breaths in our lifetimes. Most of us don't think twice about it. But for those that live with respiratory diseases, every breath can become a struggle, especially during activity. COPD imposes a substantial burden on individuals with the disease, but it can also remain latent or quiet for many years. As it gets worse, people find it more difficult to carry out activities to the point that they cannot do any more normal daily activities due to breathlessness. There may be a considerable financial burden due to limitation of both workplace and home productivity and costs because of medical treatments. In summary, COPD symptoms and disease are an overall burden in terms of symptoms with physical activity, symptoms with sleep, anxiety, and depression, as well as decrease in quality of life. There's also an increased risk of exacerbations as the disease gets worse. Smoking cigarettes is the main cause of COPD. But over the last decades, other risk factors have been recognized. And it's also recognized that someone can have COPD without ever being a smoker. There's a rare genetic disorder called alpha-1 antitrypsin deficiency that can lead to COPD. Secondhand smoke exposure, but also regular smoking of marijuana can be a risk factor. Air pollution, including exposure to dust or chemicals, and having repeated lung infections as a child, as well as asthma, can be risk factors for COPD.
Au Canada, 2 millions de personnes vivent avec la MPOC, une cause majeure d'invalidité et l'une des principales causes de décès. La MPOC est la seule maladie chronique dont la mortalité augmente. La MPOC, c'est aussi la première cause d'hospitalisation dans le pays et selon l'Organisation mondiale de la santé, la troisième cause de décès mondialement, entraînant en 2019 plus de 3,2 millions de décès. La MPOC, c'est une maladie incurable, mais il est possible de ralentir la maladie, ralentir sa progression et traiter les symptômes ainsi que ses complications, comme par exemple l'intolérance à l'effort, la survenue des exacerbations, les hospitalisations et la qualité de vie. Les principaux traitements de la MPOC sont éviter certains facteurs de risque importants, comme le tabagisme, et rester à l'écart des lieux enfumés et pollués. Il faut prendre ces médicaments, ce qui inclut principalement les médicaments inhalés, et pour certains patients, de l'oxygène supplémentaire. L'éducation et l'autogestion pour apprendre de nouvelles compétences et adopter des comportements d'autosanté qui sont nécessaires afin de faire face à la maladie au quotidien. Suivre un cours de réhabilitation pulmonaire avec programme d'éducation et d'exercice. Les causes du mauvais diagnostic de la MPOC sont attribuables principalement au fait que le test nécessaire au diagnostic, soit la spirométrie, n'est pas réalisé. Les erreurs de diagnostic et le sous-diagnostic de la MPOC sont fréquents. Des situations comme le tabagisme actif, les symptômes respiratoires comme l'essoufflement et la survenue de bronchites à répétition devraient inciter les médecins à suspecter et à poser un diagnostic de MPOC en demandant une spirométrie. Le fait de ne pas poser le diagnostic de MPOC empêchera le patient de recevoir un traitement approprié pour sa condition et éventuellement empêchera de prévenir les complications en lien avec la maladie.
In summary, COPD is a chronic progressive disease of the lungs, and it's often underdiagnosed or diagnosed late. Although smoking is an important risk factor, we need more research so that we can target patients who are at risk and also those who have never smoked. The impact of COPD is both on patient life as well as on the healthcare system. And this is a growing problem in our society due to our aging population. More research, such as CanCOLD, a Canadian COPD study that is really a dream come true, is needed. CanCOLD has helped us learn about early disease progression with respect to new factors, such as air pollution, and differences in how COPD affects men and women. This novel study continues to help us better personalize COPD investigation and treatment for the modern world.